Hello, everyone, and good evening. My name is Sakia Royal, and I am a state worker here in North Carolina and the vice president of our Public Service Workers Union, UE Local 150, and a part of the Southern Workers Assembly. I would like to welcome workers and the supporters to our third Workers Assembly webinar on the Safe Jobs, Save Lives campaign. The webinars provide a platform for workers to share and build support for their struggles in the protection of themselves, their families, communities from the spread of the coronavirus, COVID-19. Part of this struggle includes working to get personal protective equipment, paid sick leave, living wages, and hazard pay, and promoting and demanding Medicare for all. However, the Safe Jobs, Save Lives campaign to stop the spread of COVID-19 is not simply a health and safety struggle. It cannot be won if only viewed as a health and safety struggle. The Southern Workers Assembly sees this campaign as organizing a working class struggle to build and mobilize the rank and file actions in multiple industries and workplaces in private and public sectors through the South. Southern Workers Assembly has been doing a lot of good work here in the South. We have launched several Safe Jobs, Save Lives campaigns and have worked in our workplaces. We have done sticker campaigns, online petitions, sending petitions to our local and state governments, and lots of other work that we've done in our workplaces. Today's webinar features our transit industry, mainly our local transportation transit workers. So again, we would like to welcome you to this webinar, and we will definitely make time for questions and answers at the end of the session. So if you could please drop your questions in our chat box. And we have a panel of questions for our panelists today that they will be answering during this webinar. So our first question that we will have for our panelists are, what level of COVID infections have occurred in your plant? And how did you discover that your coworkers were infected? Our second question is, can you describe some of the specific risks related to the COVID-19 exposures that you face as transit workers? The third one is, what type of actions were you able to help mobilize your coworkers to take together? 4 is, what was the response from the employer? The fifth one is, how do you and your coworkers feel about it? And did it help build your organization? And the sixth one is, who in the community came out to support you? And can you talk about the impact of the police murderings of the Black people and the Black Lives Matter? And how has your workplace and your working conditions been affected by it? And has there been any actions or efforts made by your coworkers at work to show solidarity for your Black Lives Movement? So these are the 7 questions that the speakers will be speaking about today. And so without further ado, we would like to introduce our first speaker, Mr. Greg Roddy. Greg is a bus driver and president of the Amalgamated Transit Union, Local 725 in Birmingham, Alabama. Greg, we thank you for joining us.
Thank you. Thank you for having me. My name is Gregory Roddy. I want to make one correction. I'm proud of my operators, but I'm a mechanic, and I work for Birmingham Jefferson County Transit Authority. I am the union president of the Local 725, the Amalgamated Transit Union. With the questions that you listed, I mean, there's some good questions, and I do want to kind of elaborate on a few of them, but I first off want to talk about some of the things that we as a local 725 has gone through during this COVID situation. Back in March this year, when all of this was pretty much beginning to start, we went through management with some suggestions and also an MOU to try to beat the situation before it got to a point where it is now. So we did bring some suggestions to management, and this is part of some of the things that we talked about before, as far as having a fight, creating a fight, making sure that, we are heard as to what it is that we need to be able to work in a safe environment. We went to management numerous times and asked about PPE. That was pretty much the first step in moving in this direction. And they pandered us for a while, and we continued to ask and ask for it. They would ration it out. They would make it like it was gold and nobody could get it. So we decided one day that we would not do any work. We didn't strike. Everybody came to work, but we refused to work because we did not have the proper PPE, and it's a safety issue. So once we did that, I noticed that the same day, we've been trying to get them to give us what we needed, but that same day, within hours, we had masks. We had what we needed to go out and protect ourselves a little bit. From that point, moving forward, there were some other things that came up in our struggle that we continuously went to management about, but they seemed to, again, pander about things. We tried to introduce another MOU for hazard pay. That got pretty much shot in the head. But what the company did, because of we were being the union, and we were together, we really together about what we wanted to do. And I can say that first event that we did as a union, it did pull our membership together so that we stuck together as to what we wanted. So that helped us in getting a little bit of media attention, and it also helped us in getting some of the board members to listen to our pleas. So, the situation came up on the hazard pay. We felt that we were taking a lot of risk in doing our job. When you're driving a bus, you do put yourself in a lot of risk that the average person don't put themselves in. You got people getting on and off buses. They don't have protection. They are sick. You got a lot of homeless people. If you notice, in a lot of these cities, buses are pretty much the hub for the homeless. A lot of people that are homeless, they hang around bus stations. They ride the bus. Sometimes they get on the bus and just ride the bus to go somewhere because they don't have anywhere to go. So that is a situation where it actually builds the risk for bus operators to get this virus. And we pleaded with the company about. I can say that they allowed us to have rear boarding, and they blocked off certain seats. But as you know, this virus it's airborne. Don't nobody really know about the COVID-19. We're all learning about it. We're trying to get an understanding of how it's transmitted, who's more susceptible to it, all those things. So, I mean, you would think that management would want to try to work with its employees to try to help solve some of these things. I'm gonna tell you, because without us, there's no transit. I'm gonna say this, and I'm with the ATU, and there's a few panelists from the ATU. We've lost a lot of transit operators, bus drivers, mechanics, due to this virus, and how they died, what their conditions were. It's a tragedy. It's a tragedy. I mean, it's a few personal friends of mine that I actually, saw, hey, they're gone. Why? The question is why? What did we do? What do we not do to help preserve these people's lives? And I'm going to say now at Birmingham, we have about seven, I think we have like 7 people that has acquired the virus. And right now, my fight right now is going to be, why have nobody came in and tested everybody? You know, you give somebody get that virus and you find out that they got it. You need to do something to prevent other people from getting it. And some of the stuff that the CDC has put out, you know, our company is not, we're not going by. So as far as my struggle is that we're going to go and we're going to make sure that we get our personnel tested. We're going to get this place cleaned up. We're going to do what it is that we have to do to create a safe work environment. I kind of got off the questions, but you know, the question one is talking about what level of infections occurred in your plant. Well, I just told you it's about 7 people. And can you describe some of the specific risks? Well, we know that if you don't wear a mask, if you're not using the right PPE, you know, those are the things that you're going to have to face with the exposure of it. Type of infections you're able to help mobilize. Well, we did mobilize on, we mobilized on masks, and we did a good job. But that was just one phase of what we need to do. It's just so it's so we can't really understand the degree of this virus. I don't think nobody can. But then you have people that don't take it serious. When you have someone that is sick with this virus and they're close to you, you seem to want to understand better. And I think that everybody should take that mentality. You know, we should all look at it as if it's us or somebody that's very close to us. I know that some of the people I actually trained with the ATU, that we actually went to class and we intermingled, we conversated, we became friends just from being within this union, and now they're gone. So I feel like it's my position to make sure I put the emphasis on proper PPE, proper protections, and to award our people for the risk that they take. Because this is not an easy job. You have people that gets up here every day and come to work faithfully to do their job, and they get nothing from it. I'm going to say about a week ago, the union introduced an MOU for hazard pay. We feel that it was a slap in the face as well because they refused to negotiate with the union and tried to negotiate with the board. And at the same time, they used what they call it, a union busting tactic. So what they did, they gave us hazard pay, but what they did, they also separated the pay to where membership would consider, why did this person get more compared to me, or why did that person get more? So that means you got your membership pretty much in at odds with each other, rather than being at odds with the company. You're within the union, and this is one of the things that I talk about as far as solidarity. We have to understand, as a union, in order for us to get anything done as a union, we have to be together. And a lot of these companies, they do things just as that to distort the union. We need to stick together as a union and make sure that everything that we work for is for everybody. Hey, the response from the employer, like I say, was to give us masks, but they're pampering us with little small stuff. You know, they're separating us by giving us hazard pay that's not feasible for each and every employee. I'm going to say that we got $21 million in Birmingham for the CARES Act. And what they're trying to do is use CARES Act money to do everything but help the employee. That's a fight that we have, and that's a fight we're going to continue to have. The community did come out; they supported us. We have bus riders. We have a bus advocate that, you know, she came out and actually fed our bus drivers to let them know that they appreciate it. But then the company didn't do that. They came a week or two later because they felt that they had to do something to show appreciation. And I don't think that, I mean, if you really got a company that cares for you, they will sit down and they will talk to you and try to understand what your needs are. What could you do, or what can they do to make your job a better job and a safer job. As far as Black Lives Matter, I'm going to tell you, that actually hits me at home, because I've got a lot of people that I know that were actually needlessly killed by police officers. A friend of mine, we used to play chess all the time, and this guy was running. He was actually running from the police. He jumped the fence, and the guy stood there. It's like it was target practice, and he just shot him in the back. Pop, 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 pop. And that hit home. And for me to see some of the things that's going on in our country right now, and police are getting away with the things that they're getting away with, it's just, it's like nothing has really changed when it comes to civil rights, or when it comes to anybody's rights. Because if you got on a badge and you can go and kill somebody, and like the girl say, I don't know, why did you shoot him? I don't know. And you can walk away from it. We have a serious problem in this country. And I'm glad that people are taking notice of this, and people are protesting and doing the things that they're doing. In my local, as a local, we have not organized anything, but we have been a part of a lot of different things that's going on in Birmingham. Hopefully, with time, we will be able to overcome this. I mean, this is madness for it to happen. And the bad part about it is, every time it happens, it's like it increases. It's like once it gets out, then the cops want to go do more. And then they want to try to justify it. And I think that's terrible. That's sickening. You know, I spent time fighting for this country in the military, and I had a lot of friends that were white guys. But for me to have a friend, as long as I've had a friend, and come to find out that he's a racist, that's even worse. You know, you walk with these people, you live, and you fight alongside them, and then all of a sudden you find out that they hate your guts. They live with it. I think, as far as, with what we do at the ATU Local 725 in Birmingham, there's a big long road for us to travel, and I'm just asking that, anybody that's willing to join in and just fight for a cause such as these. This is what we need. This is definitely what we need. We got to look out for each other. We are our brother's keepers. And we definitely have to be in solidarity if we want to go somewhere, if we want to move anything. With that, I'm going to end my part of this, and turn it over to Sikia.
Sakia.
That's your name?
Yes, it's Sakia.
Okay.
Thank you.
All right.
Well, thank you, Greg. And if you have any other questions for Greg, please. Apologies. If you have any other questions for Greg, please put them in the chat. Like he said, we are doing a lot of important work here in the South and here with the Southern Workers Assembly. And in our link, we have a link that's in our chat box below for a link for donations. To fund this work that we do, it takes a lot. And so we ask for our members and our friends to donate. We have a GoFundMe page, as well as a link for a monthly membership. A monthly donation. So you or your organization, or an organization that you know, would like to make monthly donations, or just a one-time donation to our GoFundMe page, please share the link. And so moving on to our next speaker, we have Miss Nichelle Dunlap. Miss Nichelle Dunlap is a UEU Local 150 member and a paratransit operator for the city of Charlotte. She is the recording secretary for her Charlotte chapter for the City Workers Union at UE 150, and a non-fire, non-police city worker in several cities across the North Carolina. But in Charlotte, we have members that drive buses for people with disabilities, such as Nichelle. She is a writer, an author, and a spoken word, and a public speaker as well. So Nichelle also works for the Lynx light rail system. So the question that we have for you, Nichelle, is you and I are both public service workers in North Carolina where collective bargaining is illegal. Yet we have been able to organize to win changes. The City of Charlotte chapter has been a prime example of our rank and file activity. Can you share with us what you have done there to keep paratransits and light rail workers safe?
Thank you, Sakia, for that introduction, and good evening to everyone that is viewing this webinar. Thank you too for all of you other Southern workers members who are helping with this cause. For STS, which is the department that I work for here with the City of Charlotte, as Sakia said here recently, we transport most persons that we transport, we come in contact with, in order for them to be able to ride the service. There has to be something that some physical disability, mental disability, not necessarily physical all the time, but there has to be an underlying condition which gives them the opportunity to be approved for this service. So with that being said, that just goes to show you the risk that myself as well as my other coworkers, we take every day. So one of the things I believe you said, what are the things that we have been doing in order to help keep this fight moving forward? We have recently here, just about a week ago, I believe, we all signed a petition that had certain demands that the workers were in need of and did not have. And some of those demands consisted of, we were demanding for the staggered schedule, the AB schedule to return. We were also demanding that the hazard pay be increased to 10%, simply because of those persons that we transport. All of those persons have a high risk of COVID-19. So our day-to-day is crucial. It's crucial to them as well as it's crucial to us. We are not only being put at risk, but we're also putting them at risk as well. A few of the other demands that we included in this petition was that we wanted to have the support of management as far as backing us and adhering, causing the riders, requiring the riders to adhere to Governor Cooper's directive that was just handed down. I believe it was 2 Fridays ago, where every resident here in North Carolina, in order for you all to be out in public, within 6 feet of someone, you would have to have a face mask. Now, a lot of the workers, a lot of my coworkers are a little bit confused about why we received a memo from the HR management on the same day that Governor Cooper handed down the directive, saying that we could not deny a ride from any individual that did not have a face covering. And the reason that is because my particular department, we are federally funded. And because we're federally funded and we don't have any leadership that actually stands with and for the people on a federal level that will back up the state's directive that was handed down from the government. So therefore, we cannot refuse a ride simply because they are fearing losing those monies, which is what is going on here across not just the state of North Carolina, but nationwide, where the state are, governors or persons in leadership positions are trying to push us back to a business as usual state, simply because the funds mean more than our lives. Another one of the demands that we were asking is that we all have at least, if not the testing for the COVID, when people are returning back from the AB schedule, at least have a temperature check for the workers that come into the building. I know that over in Charlotte Water that they do utilize this particular step where they're testing, the temperatures of the workers before they proceed in to start their workday. This is a good measure that we should be practicing as well over on the STS side, which we have not yet started. That has not yet been incorporated into our day-to-day operation. Another act that we have done, the petition that I just told you we sent to our city leadership. It was sent to every council member, as well as the city manager and as well as Mayor Lyles. And we are actually in the process of waiting to hear what their response will be. We also have had sticker campaigns here in the past, and about 2 months ago or so, I believe it was, my president, Dominique Harris, as well as our brother, Craig Brown, we called for a news conference out front of solid waste on the morning that the drivers were having to come back. They had been called back in from the AB schedule. And people that are familiar with the solid waste, you know that there's normally 2 to a truck. And it is impossible for the workers to adhere to the 6 feet social distancing guideline if you've got 2 people in one vehicle. And so there was a news conference that was called in reference to that, to see if we could get some type of response, some type of act from management to resolve the situation to where the workers over at Solid Waste could have better protection for themselves at an already high at-risk job that they perform. We also have a form that the workers can fill out about their concerns or what have you due to this COVID-19 pandemic, the concerns that they may be facing, anything that they feel like management has been neglectful. Seems as if that most of the complaints are around about the same. So we're just in the process now of trying to pull those complaints together and then figuring out how we can address the ones that has the highest priority, and see if we can get management to respond to the complaints and to do what it is that we know needs to be done in order to keep these workers safe as they perform their day-to-day. I do believe that was your question that you asked for me. So that is my answer. That is a report, and I thank you for the opportunity.
Well, thank you, Ms. Nichelle. And if you have any other questions for Nichelle, and again, thank you, Greg, for that sharing the information and sharing your struggles in your workplaces. And if you have any further questions, please put them in the chat. And so up next, we have Ms. Nikita Howard. Ms. Nikita Howard is an electronic technician in the rail maintenance department at MARTA in Atlanta, Georgia, where she has worked for 27 years and a member of the ATU Union Local 732. And we welcome Ms. Nikita.
Okay, good evening, everyone. The main question is, okay, what level of COVID-19 infections occurred in your plant? Right now, as is stated on MARTA's website, is recording 95 current cases. Since I believe they start back in maybe March or April of this year, recording, the numbers are doubling, consistently. They're going up. The projection is not even close to going down at this point. And how accurate those numbers are is questionable, because in some cases it's labeled by departments. And in some departments, they have no reported cases, or they have one reported case. But we know that there are many people that are out due to COVID. Right now, we have two, I think, work crews and track maintenance right now that has been infected, or they have been in close proximity of the worker that was the host that has the infection. So you have 2 crews that are out. So what that means is you have no one there but 1 crew to do to keep the whole fleet going. So those people have come in contact with other people. Now, as workers, we're not notified. It's no special bulletin. It's no real-time information. We had a bus garage, Laredo garage, when COVID hit. It spread it like a wildfire. But workers were coming in, and supervisors wasn't telling them that people were going home sick due to COVID. So, this is a concern because, you're talking about health and safety. And, but at this time, we weren't given the 2 weeks where you could take off for COVID. We had to fight for it. We had campaigns because workers had concerns about not just their safety, but the safety of their family, their wife, their children that they had to go home to. Because we are essential workers, just like healthcare workers. And I think I wanted to also bring to the point that the buses at that time, they did not have the safe distance apart. We had to fight for the seats to get blocked off. So all the things that are in place is not perfect. The system is not perfect. We're still working it out when it comes to the passengers getting on the back of the bus. That had to be addressed so that they don't come in close contact with operators. Because we have operators that have health conditions that COVID would trigger and have a negative impact. And we know that if you have, a health crisis, that, you're more susceptible to, hospitalization or going on a respirator, those type of things that people are concerned about due to this pandemic. No cure for it. So I think sometimes, it's misunderstood the urgency of PPEs because you have all types of people coming in from the airport, getting on trains, getting on buses. And mind you, we never stop operating. It's an almost 24-hour operation that's transporting COVID. And the workers are in close contact and proximity with this pandemic daily. And there's no face to COVID. It's no cure for it. And those are the things that are a concern in our garages. As we go into the facilities as maintenance workers, anything you touch, you could become infected because this virus is in the air, meaning if you have recycled air, you're still breathing, even though the areas are trying to bag people up, they're trying to tell people to wear masks. It's not 100% that you are safe from this COVID. And basically how most of us, like I said, discover that it's an outbreak is from other workers. And in some cases, operators carpool together. They will ride from the train station to the bus garage together or vice versa. So one worker found out from another worker that someone she gave a ride to was infected. No one told. The company didn't put it out. So it's reckless for people that we know that are highly intelligent, that this type of behavior, wouldn't be taken as serious because this matter is detrimental. There's no coming back from death, but we treat it so cavalier, as if, oh, we'll catch it, but it's just like a cold. And it's not a cold. It's no cure. There's no cure in sight right now. And you know, so for transit, we're basically a host for this disease. And you know, I want to put this out here. Just about every operator or maintenance tech or mechanic or cleaner, they come to work and they love to do their job. We all love what we do, but we don't want to die doing it. And the other, the question is, how can you describe some of the specific risks related to COVID-19 exposure that you face as transit workers? I think, you know, some of the specific risks and some of the concerns as far as contracting COVID, you know, is passing it along to people you love, you know, your parents, your children, because this disease is making people suffer. This is not, you catch it, you're gone. It's catch it, you're gonna suffer, and it's gonna take its toll. And I don't know about, you know, powers to be, but I would hope that they would make decisions based on thinking of their workers as having, you know, people that have families. Offer us some compassion when we need it, because we all need one another. This is not the company against the union needs against the company. This is all of us against COVID. And that's how it needs to be addressed. So we want to avoid exposure as much as possible. What type of actions were you able to help mobilize your coworkers to take together? Now, one thing I can say about Makisha Walker, Gwinnett County Transit, they have led the way, and Marta have inadvertently kind of followed and took you know, the next steps based on a lot of things they've done at Gwinnett County Transit. The fight for the PPEs, bringing notoriety to the forefront so that we can offer some of the safety measures for our workers. Gwinnett County recently had a No Mask, No Ride rally. And this was just July the 10th. No mask, no ride. We are probably about 4 or 5 months into COVID. Why are we still talking about no mask, no ride? So workers were fed up. Your life in danger, you need to do something about it. They took it upon themselves to have a public outcry of support. And thank God, the city of Atlanta with Mayor Keisha Lance Bottoms, the city of Decatur, the city of Doraville, and a lot of other cities are saying, look, their push is with the fact that this virus is killing millions here in this country. I mean, it could affect millions in the nation, but it's killing over 100,000 people, maybe 111,000 people. These are your neighbors. These are people. So now it's closing in, basically. So what is it to stop it from spreading to others? What makes it stop us not being able to come home to our family? Every day I come home and I see my family, I see their smiles. That's a blessing to me. I don't want to put that at risk. And I'm sure others don't either. So we need to show more empathy, more compassion as our leaders. We look for them for guidance. We look for them to have our best interests, and we can fight this together. And that's what we need to focus on. It's about coming together for a common cause. And like I said, the actions we take to mobilize is just calling out legislators, social media. You can go to concerned members of ATU Local 732. We put out information. Paul McClennan, he's instrumental in community organizing. He's a strong advocate, a strong voice, fighting for workers, fighting for the rights of working families. And so those are things that have been instrumental in mobilizing. What was the response from the employer? From the employer, I think most of their guidelines, I think they're following is from the CDC. So due to the CDC guidelines, they could be delayed in their response and knowing what's going on in transit and kind of disconnected. But I think it would be important for our leaders to take a proactive approach. I think that would be great. And how did your coworkers feel about, I'm trying to think, feel about that did help build your organization? Basically, our coworkers feel that we still need things in place to help build an organization. We need shields that will help the operators feel a little bit more comfortable, safe, protected. We need more PPEs. They're running out. They're running low. We need hazard pay. We receive heroes pay, one-time stipend, which everybody received heroes pay that one time. And basically, we've been getting a lot of support from people in the community, and we would ask that they continue to support us. And when it comes to the impact and Black Lives Matter and the COVID, with transit, a lot of us are in the community. We're part of the community. We live, we work, we do everything with our community. So a lot of us were part of other organizations that go out and rally and support Black Lives Matter. Stand up for what's right and what's just.
Well,
Thank you.
Well, we thank you so much, Nikita. We heard that your local has been very active in the fight for the safety of the bus drivers and the mechanics in Atlanta, and we appreciate it. And before we go on, I have a question for you and the previous panelists. How many people work for the MARTA in Atlanta? An estimate, and what is the racial makeup of your workforce?
Okay, we have over 5,000 MARTA employees that's represented and non-rep, and a lot of the and the racial makeup is like we have about 3,000 represented workers, union workers that are at MARTA. So most of us has been non-essential when it comes to union workers. We have to be at the job despite what's going on throughout this COVID situation. The non-reps were able to work from home, and that was the disparity. We don't have that option.
And so, what's the
makeup,
racial? Yes, I'm sorry.
Yeah, no worries. Thank you. The racial makeup for MARTA is around 94.9% African American, and that's a concern when it comes to our leadership and how we feel about is color dictating what you care about when it comes to our safety and our welfare.
Absolutely. And Miss Nichelle Dunlap, real quick, the city of Charlotte, the department that you work for, you know approximately how many people work in that department and what that racial makeup is?
I believe the city of Charlotte has over 1,000 workers. And from just my uneducated guess, from seeing my colleagues out in the field, and just basing it off of the percentage of African Americans in my particular department, that's probably about 90%.
Okay. Thank you. Thank you, Ms. Nichelle. And Mr. Gregory, real quick. Okay. Well, Greg could get back with that with us with those statistics. We're going to move on. We're running a few minutes behind. We're going to introduce Mr. Antony Maben. He is the president of the ATU Local 770 in Mobile, Alabama. Antony is also the first vice president of the SW Mobile Central Labor Council and the first vice president of the Mobile, Alabama chapter of the NAACP. So we would like to welcome Mr. Antony Maben.
Good evening, everyone. Thank you guys for allowing me to talk on this evening. Just to bring you guys a little up-to-date what I have that's going on here in the city of Mobile, Alabama. Our transit authority first started having issues with the COVID back in April. We touched bases with our company, trying to put pressure for us PPE. The company got mad with the drivers. The fixed route drivers actually suspended the service for 30 days. And also was going to make the drivers use the CARE Act, which was we was given 80 hours worth of COVID leave. They wanted to use the COVID leave for their time out when they suspended the service. And also they wanted to force the employees to use their personal time once the 80 hours of care time was done. Since that time, we have got the drivers back to work. Also, the drivers was doing rear aborting and no fares for 2 months. But as of July 1st, 2020, the company went back to taking on fares and also front door entries. On about 2 weeks ago, we posed questions to the company about what they was going to do for us protection, as far as any type of covering or anything like that, as far as to block the air out for the drivers. The company came back and told us basically that the union can go find some if they would like, and they would have to approve it in order to protect the drivers. So we kept pushing them and also putting pressure on the company and asking them, you know, if they don't answer our questions, some of the things that we had asked, that we would have to go to a higher authority. So as of Friday evening at 7 p.m., we was told that they will require the passengers to wear face masks and things like that, because what happened was the mayor did an ordinance of for 30 days to make it mandatory that if you aboard any type of public area, you would have to have a facial mask in order to go in. The company told the union that basically they could not require the passengers to wear facial covering, and they don't enforce the law, and that they will have to call the police. So with that being said, we asked questions, can our members call the police? Can the supervisor call the police? Or could they call base and base call the police? Either way it goes, you know, that's a law that was in place for 30 days and they should be honoring. They went on ahead and said that they would honor it. Then also we asked would they post something on the buses so the driver wouldn't get into any type of incident with a passenger asking them to wear a face mask. We have had in other states where people was asked to wear masks and drivers were actually assaulted due to this for their protection wise. And they said they will post something on that. The company, we got $8.8 million in the CARE Act, and the company only has gave a $500 bonus to only certain employees, not the fixed route department. Their money has been used for other things other than just taking care of the drivers for what needs to be done. Also, we have had assaults as far as the membership, those who fight against the company pertaining to COVID-19. Company picks with them, try to terminate them, try to suspend them and things like that. Those are some of the things and the concerns and issues that we have here in the southern Mobile. What level of COVID-19 infection occurred in our plant is very minimal, but we do have some. how do we discover about the infection? What happens is we ask that the company provide us all the occurrences and things that we receive from our members. And once we see that a member is out for a certain length of time, we contact that member and ask them how they're doing. And at that time, that's when they tell us that they had the COVID-19 and they are being quarantined for 14 days. Other than that, we wouldn't know anything about the individual being quarantined for COVID-19. Can I describe some of the specified risks of the COVID-19? Well, one of the biggest issues that we have as far as exposure-wise is the fact that our bus is not clean on a daily basis due to the fact that we are short-staffed. Also, the company, we are pressuring the company to try to get a company in provide the equipment to sterilize the buses daily. The company is very light on trying to get things for us. They take it as a joke. If we don't put pressure on them, then these are the things that we have. What type of action have we been able to mobilize? Well, we fought back hard for the PPE. The company has started providing the sanitizer, the hand wipes, and also Lysol spray and things like that. What are the response to the as far as the employer? They play it down like it's really not a big deal. They're just something that's gonna pass by, but it's a very serious situation. The general manager that make jokes all the time about, people's lives and things like that. He feel like he's helping. He's very strong in what he do. He no one should receive anything, but like I expressed to him, he in the office all day. So he don't have to be able to be exposed to the COVID-19 like the drivers. I'm actually a mechanic, and I get exposed all the time when I have to go on buses as far as doing roll calls and things like that. And also my other fellow mechanics and my drivers, we are exposed 24/7. How do the co-workers feel about that in the organization? They feel like, they're very angry that the company don't take this matter serious. They feel like they're helpless at times because a lot of times of the issues that we have, the company really put pressure on them, make it seem that though like it's either your job or, you're going to have to work through these conditions. So those are the things that we dealing with. What type of support I got? I have got support from the Central Labor Council, which I'm a part of the organization, and also the NAACP. We have had them guys to come out and do certain things and question certain things dealing with the transit system, and, including the mayor, the city council, and things like that. We also have went to the city council and the mayor and spoke on behalf of the transit system and asked where they was, how do you feel about this and things like that. So it's basically an up and down battle, all day long. Our thing for us to, Black Lives Matter, we had a conversation with a couple of our members, and the percentage of my membership is about, I explained, I went back and looked, it's about 97% African American. And we had some questions and we had some dialogue with some of our Caucasian brothers, and it was very good. We learned a lot of things from them, and also they learned a lot of things from us. We haven't had no type of rioting and things like that. We've been having some type of, nice actions and things like that, and it's been going pretty well. Overall, we are just, continuing to do the things that we do every day and trying to protect one another and also advise each other as far as what's going on and trying to stay safe out there. That's pretty much what I have to report.
Well, we will really, really thank you, Brother Anthony. It sounds like you are doing great work down there in Alabama, and we have great representation here on this panel from Alabama, and we just like to thank you, and we stand in solidarity with all of our struggles here. And so, so coming up next, our next panelist that we have is Mr. Tremel Thompson. He is a transit worker, and he belongs to the Transit Workers Union, TWU, Local 100 in New York City. So a question for Tremel is, thank you for joining us, Mr. Tremel from New York. Brother Thompson, your solidarity and support means a lot for our Southern organization. Condolences to all the union members that have lost their lives due to COVID-19. And so how have y'all been able to fight back up there in New York?
First and foremost, I would like to thank you guys for having me. And it's kind of crazy hearing people in different parts of the country have the same exact struggle as us. And our fight with COVID is just like everyone else said. When this thing first hit us, our job actually told us that masks were against uniform policy. It had absolutely nothing to do with the CDC guidelines at that point. So they kept the mask away from us because they said they follow, like the CDC guidelines. Now, if we look at the CDC guidelines do not cover transportation trades. The CDC guidelines basically cover like office work, that type of work, but it didn't address the concerns of transportation. So for all of our the bosses in transportation to follow the CDC guidance, it bewildered me because, like I said, it didn't fit our trade. But here in New York City Transit, we had something called the pandemic plan. And they actually had a plan from 2012 on how to address something like the influenza or whatever the case is. A pandemic just as this one. And they totally ignored it. And I wouldn't even say that they ignored it fully, but the bosses just didn't know this plan existed because here in New York, they don't hire transit bosses based on their transit experience. They hire them based off of their corporate experience. It has absolutely nothing to do with transportation. So these bosses didn't know that this type of pandemic plan existed. During that time, we started losing at least 10 to 15 workers a week dying. We had the most deaths than any other city agency in the country, and any one city agency in the country. And the bosses failed to react. And up here, ours is called the Metropolitan Transportation Authority. We had to nickname it the Metropolitan Transmission Authority because, just like the other panelists said, this virus, there's no better conduit to transport this virus than through a transportation network. And that's exactly what happened. The transportation networks was transporting this virus. When you're on a bus, the bus have recirculated air. The bus is a test tube full of germs. Here in New York City, what they did to give operators a peace of mind, which is kind of crazy, they put a shower curtain in the middle of the bus and stopped boarding in the front of the bus, everything through the rear, so people wouldn't have direct contact to the bus operators. But if someone coughed in the back of the bus, that operator is still going to get sick because it's recirculated air all the time. In the trains, we move the most people probably in the world in New York City. Nothing was done really on the trains until after we reached maybe like over 100 deaths. That's when the MTA took action on shutting down the subway for 4 hours for mass cleaning. And even when they were cleaning, people don't know there's a difference between cleaning and disinfecting. Yes, the trains look clean. Yes, the bus look clean, but they was cleaning them, but they wasn't disinfecting. And then with the CDC guidance and all that other stuff, they didn't really know how this virus was reacting. They said it wasn't airborne. Now it's airborne. Now it lasts on surfaces for this amount of time. Now they not sure how long it lasts on surfaces. So as they go along, they treated transit workers all throughout the world as guinea pigs. We was all guinea pigs for this virus because even here in New York City, if the transportation system don't move, the city and somewhat the world fall apart. The stock market crash. There's a lot of billion-dollar companies in New York City. These companies are not getting business because the transportation system, the virus, and all this other stuff. So they actually chose capitalism over safety. And I see that they did it in Atlanta, they did it in Alabama, they did it in multiple places. Charlotte, it's the same story throughout this whole country. And hearing some of you guys' demographics of there's 90% African American here, this amount here. In New York City Transit, we have 49% African American alone for the 78% minority workforce. And not only do they treat us bad with this pandemic, they've been showing their true colors with us when it came to discipline, when it comes to contracts, when it just comes to the treatment of employees, period. They treat us poor, where the dominant population is people of color. Like even in Long Island Railroad and Metro North, agencies are still MTA, but they mostly Caucasian. They get treated totally different from New York City Transit. But even now, people still continue to work safe. Our union, I would say, was compliant in the deaths of the workers. The only time the union president says something out of anger is when the first guy died, who happened to be Italian, and the union president is Italian. That was the only time he was upset during this whole thing. During this whole pandemic, the top reps totally disappeared. Workers were forced to fend for themselves and figure it out for ourselves. We had absolutely no help from our union. Now things are starting to simmer down. They starting to want to come out, take photo ops, and act like they was doing X, Y, and Z. But it shows you that they don't care about people of color. And I see it in New York. I'm listening to you guys' stories, and all these stories sound familiar for me. Like I really didn't even have to say anything just now because you guys said it all. But it's uplifting in a way to see that people are willing to take a stand against this stuff throughout the country. But it's also upsetting to see us as a people not standing up the way we're supposed to and fighting against these injustices that we facing. And to all the Caucasian people who's watching and who work with us, there's this thing called collateral damage. In order for them to get the majority of us, they're going to get some of you guys too. So this is a fight that we need to fight together. No, Caucasians is not getting a separate contract from the rest of the group. You guys is not getting better PPE or more PPE than the rest of the group. We all must stick in this fight together, and we all must fight because they want to see us all gone. And that's basically how I see it.
Absolutely. And like you and a couple of our other panelists said that, this is happening all over the country. Majority of the workforce being minority. And it's unheard of. I can't believe it. Okay, so we're running a little bit behind schedule, and we definitely appreciate you, Mr. Trammell, for joining our Southern Workers Assembly. Next up, our last speaker of this evening is Mrs. Shay Badgett. Please forgive me, Shay. She is a registered nurse and is a part of organizing the UNC Health in Chapel Hill. Thank you, Shay, for joining us. And your question we have for you today is, we hear that the Southern Workers Assembly Communications Committee has been doing a lot of research on the transit industry, similar to how y'all did and produced a great pamphlet on the meatpacking last month. What conclusions have you drawn about the transit workers in the South working among COVID-19?
All right, thanks. We looked at several things here and came up with a list of questions to answer for our research. First, we wanted to see who actually drives a bus. And we found that there was 570,000 bus drivers in the US. About half, 54%, are men and 46% are women. And that white drivers make up 54% of the bus drivers, but Black drivers make up 27%, which again was very disproportionately represented. Asian drivers made up 2%, Native 1%, and mixed races 5%, with the average age being 54 for men and 50 for women. Locally for North Carolina, which is where I focused my research, we found that about who rides a bus, what are the demographics of the riders. So approximately 51% of riders are men and 49% are women. And when we looked at the demographics of race, we we found that white people made up approximately 46% of riders, at least here in Raleigh. Black folks made up 29% of riders, but they made up 50% of what Go Raleigh determined to be intensive riders, folks who use the system every day. And Asians made up 13%, Latinx folks 7%, Native and other 5%. In North Carolina, the buses are contracted out to private corporations to actually do the operations. I believe Chapel Hill Transit is the only municipality that owns their bus system, and they operate in cooperation with UNC Chapel Hill, the university. So the bus systems, Go Durham here is operated by First Transit, Go Raleigh is operated by Transdev, and Greensboro and Charlotte are both operated by Keolis. And locally, our buses typically serve the larger metropolitan areas. So you'll find buses typically in Raleigh, Durham, Chapel Hill, Charlotte, Wilmington, Asheville, and Rocky Mount. They typically serve business interest and leisure activities like parks and stuff like that. In North Carolina, the bus drivers are typically unionized. And the thing that's frustrating is that unions, public unions can't have contracts. So they're unionized, but they're unionized under the operating company. And so we have the Transit Workers Union in Winston-Salem and Asheville. ATU represents Asheville, Raleigh, Greensboro, and Durham, and Smart Transit Division in Asheville, Charlotte, Raleigh, Rocky Mount, and Wilmington. We took a look at bus systems and said, are they systemically racist, or do they promote racism too? And one of our comrades here, Dante Strabino, pointed out that Transdev, who operates the Raleigh buses here, is responsible for segregated buses and segregated light rail in occupied Palestine. They were also involved in segregated buses here in the US years ago, and they were actively involved in anti-union efforts in Boston not too long ago. Other examples were how buses are often commandeered to use as troop transport for police officers and used in mass arrests. Another question we looked at were, are buses good for the environment? So there's a lot of them, but are they doing us any good? And so the research shows that there's a mixed effect. Buses in North Carolina are typically diesel or biodiesel. Some of them are hybrid, that's diesel-electric hybrid, and a few of them run on compressed natural gases. So all buses have carbon emissions, which makes them bad for the environment, but the goal is that they'll be better for the environment than the number of cars that they displace. So for diesel engines, since the majority of engines are diesel in North Carolina, they emit nitrous oxide, about 20 times as much per car, and they emit volatile organic compounds. Now, these compounds and the nitrous oxide can increase blood pressure and increase risk of stroke and heart attacks. Another thing that they emit is fine particulate matter. There's two types, the 2.5 nanometer and 10 nanometer. So these are dangerous because the fine particulate matter can actually pass through N95 masks. They cause significant issues with lung and bladder cancer, and it's grouped as a class 1 carcinogen. Long-term exposure has been linked to cardiovascular disease, lung disease, exacerbation of COPD and asthma and stuff like that. This is pretty significant because Black and Latinx folks are disproportionately affected by high blood pressure as well as asthma. The last thing we asked is, are there ever going to be driverless buses? So eventually the goal is to replace bus drivers with automated bus systems once AI improves and the computer technology improves. So that will be a struggle for another day. And this was just an example of some of the research that we provide to the Southern Workers Assembly to help kind of inform these webinars. And that's it for me.
Well, we really appreciate that information, Shay. And we thank you for joining our panel. Right now we have time for a few questions before we wrap up our seminar, our webinar. Mr. Saladin, are you there? Or Dante?
Yes, I'm here. I'm shifting over to a younger person.
Yes, sir. We're going to take some questions people have submitted in our box. So Dante's going to read a few of those questions real quick for our panelists.
Great. Thanks, everyone, for hanging in. And there were so many great questions that you all raised, the panelists. The first question, which we're going to ask of back to Brother Greg Rohde in Birmingham, is you spoke lots out about what some of the issues have been. Could you speak about some of the actions that you have taken to pressure the boss? I know you all mentioned something about a board meeting and about an earlier work stoppage, but if you could speak about all the types of actual actions, they're very inspiring, that you have taken.
Yeah, well, once we actually did a silent protest in the board room when they had a board meeting. We had people to come in. We held up signs. We're actually talking about his salary, the amount of money he makes compared to, what we're asking for. We didn't do a silent protest, but we did we protest, what do they call it, employee appreciation. Like I told you guys earlier, there was an advocate that came out and she ordered a lot of, to-go meals for the bus drivers at Central Station. And a couple of weeks later, in the company, they decided they want to try to do an employee appreciation. So we kind of boycotted that. And we did a protest out on the side of the road while they was having their little function. The news media did come out. Like I say, the coverage was not what we thought it should be, because they told our story, but they did not let us tell our story. And I think that took a lot of the effect off of the story. And then they gave them the opportunity to rebut or come back with their side of the story. Right now, I just found out that we have quite a few people that has COVID-19, and the fact that the way they're going about doing contact tracing, they're not doing any of that stuff. And then they tell everybody, hey, if you want to take a test, take a test. That's not going to help. That's not going to, matter of fact, that's going to make matters worse. Because I feel like if you got an infection and it's in the workplace needs to be tested. The whole workplace needs to be tested. So them giving employees the opportunity, or should I say the decision whether you want to test or not, that shouldn't be the standard. Because if you decide you don't want to be tested and everybody else get tested, you go out, you may have it, and them coming back being tested is really no safe. There's no safety in it, because everybody that didn't test could have been infected. So I think right now we're gonna try to see if we can do something to make a protest and have everybody tested. We may go to work and not work and say we all want to be tested.
Right on, Brother Greg. Appreciate that, man. That would be powerful. Please keep us posted. As part of the Southern Workers Assembly, we try to keep track of these important collective actions and give support and solidarity. So we definitely need everyone else's support in helping us build our Southern-wide network here of Southern labor and social movement activists. The next question is for Nichelle. Going back to you, Sister Nichelle in Charlotte. Can you describe some of the specific risks that you take as a transit a worker related to COVID-19?
Yes, myself as well as my other coworkers on a daily, when we clock in the beginning of our shifts and proceed out to our city vehicles. One thing for certain that is a huge risk is there are no partitions that separates us from the passengers that are in the back. I spoke briefly earlier about the mask. Our riders are not required to wear the mask, the directive that has been handed down from Governor Cooper, because we are a federally funded operation, and this particular mandate came down from Governor Cooper, Roy Cooper, and that's a state level. So that's one of the things that we fight with daily. The riders, they are not required to, so we must transport. We're not allowed to deny service. Also, we were called back to work on full schedule, our full 40 hours, about, I'd say maybe a month or so ago. And since then, our ridership has not increased. So we're working our full 40 hours, but in a 8-hour workday, we may transport 4 or 5 people at the most. And so what that causes us to undergo unnecessary exposure on a daily basis. Most of these restaurants have drive-throughs that are open. The inside lobbies are not accessible, and the city vehicles, they cannot clear the drive-through clearances. So most of us have resulted to having to get our food, bring it back to the bus. Now, if you transport 1 or 2 clients prior your lunch, and your vehicle is unable to go through that extensive cleaning that they say that the vehicles undergo each day at the end of each shift, then that means you're bringing not only, exposure to yourself, but now you're eating on the back of a bus that has had other riders, and you do not know they may or may not, potentially carry this deadly virus. So that's one of the other risks that we undergo every day as we clock in. So those are just a few of the first set of struggles that we undergo as workers.
Thank you so much, Nichelle. I know there's a lot y'all are experiencing being on the front lines. The next question is for Nikita in Atlanta. This question is, you all mentioned, particularly in the South, where it seems that there are, from hearing from all you are, at least 90% of the workers are African-American. One of the questions was, well, what percentage, what is the racial breakdown of the bosses of the administration?
Even with the administration, I would say majority appears to be African-American, but the behavior and I think the ones who are actually making the calls, that are in charge, making the decisions, aren't people of color like myself. The boss, the CEO, is Caucasian. That's who's running the company. So it doesn't matter how many others that are below him, he's the one calling the shots right now.
Great, thank you for that, Nikita.
Sure.
I'm trying to understand how racism works institutionally in our workplaces. So the next question is for Antoni and Mobile. Brother Antoni, there was a question around the sanitation of the trains and vehicles.
They try to throw a spin at the mostly black.
What level of cleaning and sanitation do you do? Is it hourly, daily, weekly?
But the person who called the shots, it's the dull white man. Yeah. You see how they try?
Hello?
Brother Antoni, sorry, I got cut off. What level of sanitation do you do in the buses and the trains? Do you sanitize hourly, daily, weekly, monthly, between passengers?
I would say probably about monthly. I mean, because we don't even have enough staff. Right now, we are short of staff. We only have 2 full-time service employees to clean the buses.
Monthly, wow. Thank you for that. That's horrifying. So the next question, probably the last question before we want to try to end here at 8 o'clock, and this is for anyone on the panel that would like to answer this. This question reads, I'm a middle school teacher in Oakland, California. We recently worked with the community to end the police department in an attempt to interrupt the school to prison pipeline. I was wondering if any of the unions represented here have issued statements about stopping collaboration with the police, especially in terms of using buses and transit union drivers for arresting large groups of protesters. Anyone on the panel that would like to speak to that? I know we saw that in Minneapolis and New York and some other cities, but any of the southern cities, or have there been any efforts around that?
Hello, I can just speak for Atlanta. When the protesting first started, I know it was 2 college kids snatched out the car by police, and a lot of other things that kicked off some violent actions. But I know MARTA shut down its services. Buses were shut down due to the protests, and mainly because they were violent at the time, and it was for the safety and welfare of the workers. So that's what our part in it. But I agree with New York and Minneapolis and other cities that stood against carrying people to jail that were protesting, and that's basically what happened here. So.
Thank you, Nikita. And it's
Welcome.
great to have you all on. One of the things that we're doing as the Southern Workers Assembly, we are building primarily, of course, trying to support workplace organization and building committees to fight the boss in the workplace. Once those are established, though, we want to invite you all to build with us both local workers assemblies, which we are building with workers in different workplaces across one city, and we've been building those in Durham and Raleigh, and relaunch an effort in Charlotte. And anybody interested in building in your city and linking up to have more visibility and be part of a social movement as workers and build a local workers assembly, we want to support you in doing that. As well as the other kind of component of organization has been industry councils. So linking together workers, like on this call with transit workers all across the South. We've seen there's at least 3 unions and a few others represent Southern transit workers. Some industries are less unionized. There's not unions, or there might be several unions. And so we want to build, as a Southern Workers Assembly, our perspective around the need for, fighting racism and the need for building, connecting to the broader social movement and taking collective action as workers and really the control of the rank and file workers and building their unions and fighting their boss. So we want to invite you all. There's an email in the chat, info@southernworker.org. If you're interested in being part of an industry council, we're actively trying to build those in meatpacking from our last webinar, as well as in transit from coming out of this webinar. We'd love to have you as part of that, as well as building a local workers assembly. So I'll pass it back over to Sister Sakia to close us out.
Okay, well, thank you, Dante. And as you can see and listening to our stories of our comrades in different cities, the struggle for PPE and hazard pay is the same for all our companies across the country, majority of minority workers. And so the work of the Southern Workers Assembly is important work, and we like to keep that going. We have other webinars scheduled. We have some collective bargaining and collective actions that we have planned, throughout the rest of the year. And so please go to the website and go to our GoFundMe page and donate and share our link for the GoFundMe and for the monthly donations. And we would just like to thank all of our panelists for coming out and sharing their stories and sharing their struggles. And thank y'all for tuning in and listening. And everyone have a good evening.
Thank you.
Organize the South.
Yes.
Thank you.
Thank you, Paul.
Solidarity. Be safe.
Thank you.
Thank you, everyone.
Thanks.
Next song.